Okay, thank you so much for joining. We're going to go ahead and get started. Today's webinar is being recorded and it will be posted on our learning site, and we will put a link in the chat so that you can review it later. There will also be continuing education offered for today's webinar, and we really appreciate you joining for this exciting webinar on reducing plastic use in the healthcare sector. We do encourage you to introduce yourself in the chat and where you're calling from and what kind of nursing practice you participate in. And also, please do put your questions in the chat. We will try to have some time for Q&A at the end of our webinar. Our first speaker today is Oriana Turley. Oriana is the Program Manager for Environmental Stewardship System-Wide for Providence St. Joseph Health. She has a background as a medical surgical registered nurse and entrepreneur in the medical apparel manufacturing space with a unique perspective on the healthcare supply value chain. As part of the system environmental stewardship team for Providence, Oriana leads communications, supports data collection and analytics for the Environmental Stewardship We Act scorecard, supports green teams across the 51 hospital system, and supports a variety of collaborative groups nationwide in healthcare environmental sustainability. After Oriana speaks, we will be hearing from Kate Donovan. Kate is a senior attorney and the Northeast Regional Director for Environmental Health at the Natural Resources Defense Council. Kate works on a range of environmental and health issues, including working to get toxic chemicals out of consumer products and solving our solid waste and plastics crisis. Kate has 20-plus year career in environmental law and policy working at nonprofits, government, and in the private sector. So we're going to go ahead and get started with Oriana's presentation. And I will share my screen.
Great, thank you, Sarah. Hello and welcome, and thank you, Annie, for having me. So today I'm going to go through a few overarching strategies that Providence uses to address the plastic pollution problem in the larger context of how to reduce waste at scale in a large healthcare system like ours, but also how do we use our purchasing power to push our vendors to evolve and think differently about the products that they make. Plastic use, as we all know, is widespread in healthcare, and with a large volume of products we buy being single-use plastics and going directly to the landfill. Just going to change my view here so I can see the slides a little bit better. Great, thank you. Next slide, please. And just for a little bit of context, Providence is a large Catholic healthcare organization. We serve 7 Western states from Alaska all the way down to Texas, 51 hospitals, 1,000 non-acute facilities, including clinics, surgical centers, etc. And Providence's mission really calls us to serve all, especially the poor and vulnerable. And our environmental stewardship program is rooted in the Providence mission and the core values, especially our core value of justice. Which states that we should care wisely for our people, our resources, and our earth. And so we stand in solidarity with the most vulnerable, really working to remove the causes of oppression and promoting justice for all. With the large scale and scope of our organization, we really want to be part of the solution and not the problem. That's why we're all here and why we do this work. We know that healthcare is polluting. 8.5% of annual greenhouse gases in the United States come from the healthcare sector, and 4.5% globally are from healthcare. So we see this increasing health crises in our as our climate changes with acute climate shocks and extreme weather events. It's more and more prevalent in the communities that we serve, and we need to prepare and respond. And climate resilience is necessary to continue to provide care to the communities that we serve. Next slide, please. So a little bit of background. In 2009, the Sisters of Providence were handing the hospitals and health ministries to lay people, to a community board, and they left a document speaking to their hopes and aspirations for the healthcare ministries going forward. These 3 quotes we call on a lot. They really anchor our commitment to the natural environment specifically and remind us of our abundance and our responsibility to care for creation. Next slide, please. Environmental stewardship at Providence has been fostered as early as 1993. Our organization made a bold aspirational goal to work toward carbon negative. And since that goal has been announced, we've made huge strides forward in data collection, metrics, creating metrics for tracking progress toward our goals, increasing transparency of our data collection, and pollution reduction across our whole organization, which we're really proud of. Next slide, please. I'm not going to dig too deep into greenhouse gas accounting, but I want to make sure we start with the understanding that Providence, we are a carbon emissions focused organization. What this means is that we translate all of the pollution we create into metric tons of carbon dioxide equivalents. It's a mouthful, but we use emissions factors to do this. And we do this so we can measure the many different kinds of greenhouse gases emitted from our facilities, from the products that we buy and use, and then the different ways we dispose of our waste into one common metric for tracking purposes. So when we say that we're focused on decarbonizing healthcare, what do we mean? There's several groups of common greenhouse gases, with carbon dioxide being the most prevalent. There are others that are important in healthcare, which we won't really talk about today, including anesthetic gases, nitrous oxide, etc. But these chemicals have different global warming potentials, which is a measure of their potency. And for easier calculation and communication about our goals and our progress, we translate into metric tons of CO2e. That's what the little e at the end is equivalent. And so decarbonizing to us means to mitigate or reduce greenhouse gases by reducing and eventually eliminating them. All materials have different global warming potentials, and plastics, as our examples today, have carbon emissions associated with production, the use, and the end of life of each product. Next slide, please. So I just wanted to have this slide in the deck for sharing purposes later, but I'm not going to go too much deeper, as I said. But plastic products specifically, we buy fall mostly under Scope 3 emissions to the greenhouse gas protocol, both under purchase goods and services category, and then on the other side, the end of life side in the waste category. So these are the two categories in which we account for the greenhouse gases of carbon dioxide in our purchasing, our use, and disposal.
Oo, kasi ini talaga how to decrease plastic in healthcare.
I think someone's off mute. Great, thank you. No problem. Okay, next slide, please. Oh, and one more time. I forgot about that fancy graphic. Okay. So when we break down those items, we're able to more accurately measure. This pie chart has the 7 big buckets of those items that we track and measure across all 3 scopes. In waste, I do want to note that the chart reflects carbon emissions, but there's more to waste and to plastics, both the buying and the disposal of plastics, than just carbon emissions. And it's important to address it for other reasons beyond its potential to just pollute the atmosphere. Everybody in hospitals, as we all know, we touch waste. It's extremely high volume of physical output from the hospitals, lots of contamination concerns. And while greenhouse gases are difficult to see and sometimes complex to understand, everybody understands the problem when they see a compactor full of trash leaving the hospital. For reference, at Providence in 2023, we disposed of, so this is biohazardous, hazardous, and landfill waste, over 76 million pounds of waste. And that's the equivalent of just over 24,000 metric CO2es of carbon dioxide equivalents. So it's a huge volume, a huge problem. We were able to divert from the landfill, so through things like recycling and composting, over 25 million pounds of waste away from the landfill and biohazardous and hazardous waste streams. These elements, this way of disposal, in other words, do have lower carbon emissions or lower pollution associated with them, and overall are less polluting than the landfill. In addition, and what we're going to kind of zero in today on is more of this concept of avoided waste. And we were able to avoid about 1 million pounds of waste in 2023. And we'll dive into what exactly this means, how we define this, how we measure it a little bit later in the presentation. Next slide, please. So all this work is data-driven for Providence. I'm sure you got that idea with my quick and dirty rundown of greenhouse gas accounting. So we compile all of this information into our WEAC scorecard. And tracking carbon emissions, especially for waste, is complex. We've been working at this for years to collect our data. For waste in particular, we collect usage and cost data directly from invoices. And we've progressed a lot in the past couple of years to collect 62 different data points from our hospitals or our acute care facilities. and are in the process of adding in our non-acutes as well. We've been able to add in over 500 of our non-acute facilities into our scorecard for tracking in 2024, and we expect to add the rest in 2025. So we can use this aggregated data and we can kind of compare change over time across locations, use different denominators and normalizing factors to compare different sites to each other, even hospitals of different size, to see how they're doing. And environmental stewardship work is complex, and we didn't see any way around just kind of doing the thing and collecting the data. The necessity for transparent and accurate data to drive our program to capture carbon emission savings, but also financial savings to make the business case at every turn and tell our story. So we're demonstrating millions of dollars in savings each year. At the close of 2024, we expect to have reduced our greenhouse gas emissions by 20%, which is really exciting. And for years, we've said this work saves money, though that conclusion often has been based on estimations, case studies, etc. Now we actually have the data to prove it, and we can support this within our organization and externally as well. Next slide, please. So if we take a step back, we frame our environmental stewardship program as a whole into 3 pillars that drive change. The first is We Act. This is our mitigation strategy. These are the 5 buckets where most of our greenhouse gases are emitted from. Today, we're going to zoom in on the W and the A a little bit closer, so waste and agriculture and food in terms of talking about plastic reduction. But I wanted you to be aware of the other elements of our program, which is We Reach, our resilience and adaptation element to our program, so our climate resilience planning, and then our We Share strategy, which is our advocacy and leadership work. Next slide, please. So this is just a close-up of We Act framework. Again, we're going to dive a little deeper first into the review. Next slide. And just to level set on definitions here, so our waste goal at Providence is to divert more than 50% of waste away from landfill and hazardous waste streams, which includes biohazardous, by 2030. This is the formula, our waste optimization percent at the top. This is the formula in which we use to calculate metric. And we wanted to make it as visual as possible. And essentially, we want to increase the yellow and green, and we want to decrease the red. We want to make sure that we have all of our diversion waste streams in place. So composting, recycling, universal donations to the community of usable items, and then avoided waste. And again, we're going to dive a little bit deeper into that green one, avoided waste. But I wanted to click through these slides. If you go to the next slide, just to make sure that you at least have a glance over the definitions and what specific waste categories go into each of these larger buckets. Next slide. Great. A lot of these are pretty practical, right? It's how we deal with our household trash, recycling, etc. And so next slide. One that may be a little bit new to your thinking is this concept of avoided waste and how do we measure it? We have 3 ways that we think about it primarily, and we're hoping to expand over time, but reprocessed, reused, and not purchased. Next slide. So if we start with reprocessed, our best example is we partner with Medline Renewal Program, and they have a facility in Redmond, Oregon, which is great because a lot of our facilities are in Washington, Oregon. So it's a regional reprocessing facility. And they are able to collect a lot of single-use items, some of which are listed in this chart here on the slide. And they're able to take them back to their facility and at an extremely high level of safety. They're able to reprocess them and then sell them back to us essentially for much less than a brand new device or an OEM. And so this partnership started many, many years ago, and we've been expanding it ever since. But one of the elements that we've been working on this year is a Renewal First program. Previously, it was called Auto Subprogram. But essentially, it's a way to help us maximize our renewal collections for reprocessing and our buyback system automatically. And so if there is a renewal or a reprocessed item available, the system that we use for purchasing goods and services will automatically purchase the reprocessed item until there is no more to be bought. And then it will supplement the rest of the order that's needed to fill the part on the floor with a new item. So this reduces our use of single-use devices. It reduces those devices that go into the landfill. It increases our supply chain resilience because, again, this is a circular economy. It's regional to an area where many of our hospitals are. And in 2023, we were able to divert about 160 pounds of single-use devices away from the landfill by collecting them and reprocessing them and buying them back. You can see that in 2023, we were only at 29% of usage collected. So we still have a lot of room to grow. The numbers on this program are pretty amazing. And so the fact that it's so impactful and we're only not quite at 30% of utilization of the program is pretty exciting to me, because that means in the year or two to come, we're able to really expand this program. Next slide, please. And then, so second tier of this concept of avoiding waste at scale. So reused. A lot of people, when they think about reusable, they think about washable isolation gowns, curtains, linens for beds, for perioperative areas, etc. The most successful program that we've had to date is through our main biohazardous and hazardous waste hauler, Stericycle. They have a reusable sharps container program, and we were able to expand this program system-wide to all of our hospitals and clinics. And so what that means is, when you're in a patient room or you're in your unit core and you put a sharps in the sharps container, when those containers were full, previously the whole thing was taken and thrown away or incinerated or disposed of, however, in the proper manner. Now, what they're able to do is empty those containers and reuse them up to hundreds of times, depending on the condition of the container. And so we've been able to divert and therefore not landfill almost 900,000 pounds of plastic through this program just in 2023 alone. Up next on the docket is, so most of our linens are washable already in our patient care areas, so on our medical floors and our ICU, etc. There's still some work to be done as far as our perioperative areas. And we're still in this phase of assessing and collecting data of who is doing what. Of course, we have 51 hospitals. It's a lot of data to manage in general, but we want to make sure that we know who's purchasing what, who's using what in relation to disposable versus reusable, and get a really clear current state so we can identify hotspots and where we want to work on using reusables first. And to do this, as you can imagine in healthcare, our priority is patient safety. So we work really closely with our system-wide infection prevention team. We're assisting them in collecting and providing evidence for reusables in patient care areas where we think it makes practical sense or there's some body of evidence to support it. But again, it ultimately is going to be their decision on what is acceptable and the most safe option for care delivery. I'm excited about this because I think that we can assist in helping develop the body of evidence through case studies. And we have multiple sites across our system that are successfully using reusable isolation gowns as an example. And so we're trying to hone in on those sites and see how they're successful, collect those stories, and contribute to the body of evidence as well for other health systems to use. Dishware, this last point, we mostly have reusables for our patient service line, but in cafes and the cafeterias across our system, there's still a lot of disposables being used. And so we want to make sure that we're aware of those sites and transition those to dishware as well. Next slide, please. So One View dashboard. Okay, so not purchase. This one's a little bit more abstract to think about, but especially during COVID, we think about how much waste was happening, right? We were purchasing whatever we could get. We were stockpiling supplies, making sure that we had what we needed to deliver safe care during this pretty wild time. Since then, we want to make sure that we're backing away from some of those bad habits that we developed during that time as a healthcare sector. And really, environmental stewardship work, and when you think about reducing plastics in healthcare, it's really about efficiency. We waste and throw away so many brand new items, or things are stored for too long, they expire and they're thrown away unused. And so a gentleman by the name of Dave Wilson at Providence developed an internal dashboard called OneView Dashboard. It's a surgical preference card optimization program. And the whole purpose of the program is to increase efficiency, purchase less, throw away less, and save money for the system. It's challenging to measure the waste that isn't created, but in this way, we've found some ways to do so. So each surgeon has a preference card for every procedure they perform. These cards list all the supplies, the instruments, the equipment, medication, and more needed for the procedure. And these preference cards help make sure there are no delays in surgery due to lost or missing material. Because caregivers are so busy taking care of patients, over time, these cards become inflated with additional pieces of equipment. And care teams add new items without cutting anything else on the card back. And unfortunately, a lot of unopened, and unused items usually get thrown away after the procedure, even if they're brand new. And anyone who's worked in the perioperative area knows this. Patient care and safety come before anything else. We want to make sure that the surgeons and staff have everything they need to get the job done, but ideally nothing extra that would be thrown away brand new. All right, next slide, please. So this is just a little screenshot of two of the elements on the OneView dashboard that gives us insight. The level of data collection that OneView provides us is going to be really valuable in the coming years. You can see here, this has been rolled out at 10 sites so far, and the data has been collected for the past 18 months or so. That's how long the program's been live. And already, you can see that there's an incredible opportunity for financial savings, but also for greenhouse gas emission savings. And so if you think back to, we had over 25,000 metric tons of CO2e for disposed waste in 2023 as a system. Here we have a reduction already with just a one passover for 10 sites of almost 1,200 metric tons of carbon dioxide equivalents. I mean, that's almost a 5% reduction just in these two categories at these 10 sites. And so a program like this expanded to all hospitals and, furthermore, expanding to our surgical centers, the program can reduce carbon emissions from disposed waste by over 25% just in its first round of cleaning our own house, so to speak, going into the preference cards and making sure that they're correct to what the surgeon needs. The data collected here also provides us insight for hotspots for further optimization projects. And this is great because we have so much data. This is like a process improvement team's dream, right? We have a before, we have a during, and we have an after. We have metrics associated for reduction in waste, for financial savings, and so forth. And it really can help us look both upstream and downstream in waste. So upstream in revising surgical kits that come into our hospitals, influencing product purchasing decisions, and then downstream making sure that people are segregating things properly. Next slide, please. All right, I'm going to touch briefly on agriculture and food. We work with a vendor system-wide. Most of our sites, with the exception of 8 or 9 of our hospitals, the food and nutrition services are provided by a vendor. And so we meet with this vendor monthly to talk over our environmental stewardship goals, to bring up this conversation. And we have specific goals around reducing food packaging, and we're able to help them develop a good, better, best guideline in relation to food packaging. I think some of us can always remember, or at least I could remember when I was working on the floor, bananas wrapped in plastic during COVID and just all kinds of wild things happening. And making sure that those types of habits, again, are when there's no evidence to support it, that those things are not happening. We make sure that we listen to clinical feedback. So when we hear our caregivers give us feedback about food and nutrition services, about packaging, etc., we're able to bring it to the system-wide meeting and kind of escalate these issues. And the process really, I think, has gone well for both collecting data and getting a baseline with our vendors of how much of various items and packaging items and so forth we're using and purchasing, and then also just making sure that we're communicating with them around our goals and creating good guidelines. All right, next slide. Thank you. So procurement, we've kind of been talking about procurement all along, right? Because a lot of the things that we buy, it's important to apply the environmental stewardship lens to those purchasing decisions. So making sure that our procurement colleagues understand the chemicals of concerns, especially related to plastics. We were able to get DHP completely out of our IV tubing, and this was instigated by a commitment we made to the HAN commitment, the Health Anchor Network. And we started with gloves and breast pumps to try and get DHP and PVC out of those items. And we've had great success. And so making some of these formal commitments through some of these national initiatives, partnering with our procurement colleagues, bringing them into the conversation, empowering them to lead this work and understand what it is that we're talking about, has really allowed us to have success in getting some of these chemicals of concerns out of the products that we buy. And also, when we look to our vendors, it really impacts, when we start to ask these questions and so forth, it really impacts the whole value chain, right? Because we're asking the tough questions of our organization and of their organization about how to remove these concerning elements. I do want to touch too, yes, great, thank you, on the EPP purchasing policy. So this policy establishes guidelines to ensure that sourcing, purchasing, and contracting functions are all in alignment with the organization's commitment to environmental stewardship. The policy applies to all divisions that make sourcing and contracting and purchasing decisions, and all the end users and buyers who select items, contracts, and services. So everybody that touches and buys things, they all can use this environmentally preferred purchasing policy to make better decisions for environmental stewardship. We already have worked really hard to eliminate PFAs, aka forever chemicals, as part of our technical standards for remodels and new building construction. And this policy really supports the day-to-day operations and the purchasing that we go through. This is just a quick look of the policy itself, because sometimes people are interested in the technical aspect of how we got this done. We were able to find executive sponsors. You can see our CFO as the executive sponsor, and then leadership from a lot of different areas of our organization to make sure that everyone was aware of it, that they were cascading it down through their teams, and that there was clear contact information for those folks. Next slide, please. And you can see a lot of the things that we talked about today, which again, they're pretty practical ideas, right? But when applied at scale and you start assessing your organization, a lot of the time, waste reduction, as an example, you realize that nobody's really dug into figuring out the hotspots, collecting the data, and getting actual verifiable information to make changes. And so the policy is just another technical way that we support our work. And make sure that it's spelled out really clearly for folks so they can go in and take a look and use it to justify good business, good decisions. Next slide, please. Great, and this is just additional considerations. I just want to make sure you have the key elements to the policy available to you in the slide deck. All right, next slide. All right, so really quickly, I touched on our resilience, our climate resilience planning, clinical care and operations. So making sure, again, that we are making our supply chains and the things that we purchase and the way that we dispose of our trash and our plastics specifically, make sure that we're doing it in a really resilient way. Next slide, please. And we've been able to collaborate with our government affairs team to make environmental stewardship part of Providence's advocacy platform, both on local, state, and federal levels. And so we work really closely with our government affairs team to look at the different regulations and laws and make sure we're apprised of all the things happening in our service areas. And we're able to leverage those things again to help our organization make better decisions. Next slide, please. Oh, actually go back one. I want to say one more thing, if you don't mind. So we also launched this year the Providence Center for Environmental Stewardship. A huge part of WeShare and being an advocate for this type of work in the healthcare sector is being able to share our learnings with others. It's really important to my boss, Beth Shank, and to our whole program and our organization as a whole. So the Providence Center for Environmental Stewardship, we have all of our frameworks initiatives available there. We release quarterly toolkits, which is concrete as we possibly can, how to do this work in various areas of We Act. So I invite you all to visit our Providence Center for Environmental Stewardship. Next slide. The power of partnership. So that's part of the reason we're here today. We partner with Annie, ANA, lots of national groups, and just to make sure that we are providing as much helpful information for the work that we've done so others in the healthcare sector can use. That is the way that we're going to really make movement in this area and reducing pollution, reducing plastics, making sure that our collective purchasing power as large healthcare organizations are kind of combined together to influence change. Next slide, please. A couple of other exciting things as far as longer term planning. We're partnering with vendors to do life cycle analysis of various products. And again, these are like how much carbon emissions does it take to create, ship to us, use, and throw away a specific product category. So this information is really needed in the healthcare sector so we can accurately account for carbon emissions that go into that full life cycle of a product. And it's important to collect this data and understand that the carbon costs of different products, so we can use our purchasing power to push suppliers to evolve. A lot of things have been made the same way for a really long time. And sometimes it's unnecessary to use a combination of 8 to 10 plastic to make one small product, which makes it carbon intensive to create, to manufacture, but it also lowers its recyclability, its ability sometimes to be reprocessed. And there are many instances where they can achieve the same quality, safety, and purpose by using a different ingredient list that's a little bit more environmentally friendly. And once we dig into the details of that work, we can influence those decisions and work with our vendors a little bit more. So in short, knowing the data can help us influence everything from product content, more circularity, recyclability, to reducing unnecessary packaging and the delivery of the products that we buy. We can use the data to inform the healthcare sector and its value chain about hotspots for waste and inefficiencies. And also, you know, being able to work with dozens of healthcare organizations across the country, grouped together, like I was saying before, to use our purchasing power to push for change through initiatives like CHARM and through collaboration with our group purchasing organization, which ours is Vizient. Next slide, thank you. So in summary, overarching strategies, just, you know, again, simple concepts, hard to enact and scale over large organizations and a large sector like healthcare. But choosing safer products, making sure there's a policy in place where people have the justification, something other than financial, to choose safer products and protect their patients and staff from unnecessary plastics exposure, chemical exposure, etc. Making sure that we're avoiding waste at scale. We can't eliminate plastics from healthcare, but we do need to think of ways to address the problem, both in the short and the long term. Avoiding use where possible for now, but influence how products are made in the future and ask the hard questions of ourselves, of our organization, and our supply chain so that we can all evolve into a more efficient and less wasteful industry. After all, we are all here as healthcare providers to create environments of healing for both people and the planet. Thank you.
Thank you so much, Oriana. So many exciting things happening at Providence. We're going to go ahead and turn it over to Kate.
Sorry, I have a question. People have some questions. Do you want me to read them after Kate's presentation or right now?
I think we at the end, that would be, yeah, thanks.
Sorry. Hi there, everyone. Sarah, you want me to get started? Yeah, sure. Great. Okay. Great. I'm gonna share my screen. Just give me one moment. I did this before, slideshow. Here we go. Hi, everyone. Sorry for that pause. That was really interesting to hear the last presentation, I obviously come from a little bit of a different, I guess, bend of this conversation in that I'm not in healthcare. So for, you know, my perspective is really about how do we change this plastic pollution crisis from a policy level, from kind of a legislative perspective. And so I'd love to, you know, share some of the things. Just in terms of who NRDC is, if you don't know, we're a national nonprofit, been around for, you know, since the 1970s, working to defend the earth, people, planet, plants, animals, and the natural systems in which we all live. We're a combination of scientists, lawyers, and policymakers. And you can find us at nrdc.com. What I'm going to cover today is, I suppose in a lot of ways I'm speaking to the choir. You all understand why plastics are a problem, but I'm going to go a little bit into kind of just the plastic pollution crisis in itself, plastics in food packaging, the recycling issues we have with recycling, toxics in plastics, and then legislative responses. I see that you're all kind of from around the US and different parts of the country. So my background and expertise at the moment is in New York State. So I am going to give a couple examples of legislative responses that have occurred in New York. However, I know that other states have similar programs and other responses as well. Sorry for that with dog interruption. So problem with plastics. I mean, I think we all are aware that plastics are a huge problem and a crisis from lots of different angles. They clog waterways. We've all seen the images of the floating plastic garbage patch in the middle of the Pacific and all around the world, injures wildlife. We've seen photos of straws stuck in turtles and other fish ingesting different pieces of plastic. One of the big issues with plastics is they break down or they shed into micro and nanoplastics. And, you know, the research over the last couple of years is increasingly significant in terms of the risks that microplastics are to our health. So that is certainly a big concern and why we would want to we need to start reducing plastics as much as possible. And third, plastics are derived from fossil fuels. So the plastic pollution crisis is also fueling and driving our climate crisis. I think just another thing to note is that it's expected that within the next 30 years, the amount of plastic to be produced is expected to triple. So we're really on a trajectory to continue to make more plastics, which is extremely problematic. And so, of course, all of the different sectors focusing on reduction strategies is really what's needed at this point in time. One thing I was going to talk about is plastics in food packaging, because so it's interesting, obviously in the healthcare sector, plastics are relied upon for so many reasons that are, you know, people may argue that are completely essential. And it's interesting in a lot of the legislation responses that we work on, there's often carve outs for medical uses. I think there is a hesitancy to go to do responses that are banning certain uses of plastics in specific sectors. And I would say the medical and health field is one of them in which we don't necessarily see a legislative response being directive to saying this can't be used. But one area that we do see this in is single-use plastics and food packaging. So as you will see, you know, most of the most of our waste, generated waste in the United States is food packaging, and it's plastic, 40% of it. New York, I'm in New York, so, you know, New York has a significant portion of its solid waste made out of plastic packaging. And it's really a convenience culture that we have adapted to without stopping to think about, one, do I need this particular item Is there a way to use something that's reusable, and potentially just adjusting the behavior to be slightly less convenient. At the time, we are a convenience culture, and we've gotten quite used to having things accessible extremely quickly. So some of the reduction is about choosing to make smarter choices or different choices on what we purchase, as we heard in the last presentation, and a lot of it is behavior too. So I kind of just wanted to touch on recycling, because recycling is not the solution. Recycling is part of the solution. It certainly is an effective way to reclaim certain materials in your recycling bin. I mean, paper and aluminum and glass and other materials are actually quite recyclable. So I'm not suggesting to anyone on this call that you stop recycling. The problem is that recycling plastic is particularly problematic. Only about 5 to 6% of post-consumer plastic is actually recycled. Part of the problem is that there are so many different types of plastics that exist, hundreds, if not thousands, different types of plastics, that they can't necessarily be recycled together. And they have all these different properties that make them difficult to sort. For instance, there are all sorts of, and I'll get into this in a little bit, different toxics and pigments and dyes and the green plastic and the black plastic. All of these particular plastic products make it extremely difficult to recycle effectively. So oftentimes, much of what goes into the plastic that goes into your recycling bin is actually discarded. In the space of recycling, certain chemical industries have started to promote a solution to the recycling problem, because there is not a lot of confidence that recycling works, and there are a lot of plastics, as I mentioned, that can't be recycled, like soft plastics in particular. All of our food packaging that comes in soft, like a soft bag, all of those soft plastics are particularly difficult to recycle. So industries have come up with kind of a misleading solution called chemical recycling or advanced recycling. And there are very few of these types of recycling facilities across the US. They're not necessarily scalable, but it is being touted as a solution to a recycling problem that we can burn effectively. They use very high temperatures and different types of technologies to break the plastics down into their original chemical polymer parts. And this creates a lot of potentially hazardous consequences in terms of waste and air emissions and other environmental impacts from those processes that are incredibly undesirable. And it's also a way to suggest that we don't need to start reducing our use of plastic, that we have a technology that would infinitely recycle plastic, which is not true. One interesting thing to note on recycling also is that it's really been a decades-long campaign from the plastics industry to kind of perpetuate this myth that recycling is the solution and that we're not doing our job by not putting things in the recycling bin. Recently, actually just about 2 months ago, a month ago, the state of California brought a first of its kind lawsuit against ExxonMobil for deceiving the public, for misleading and deceiving the public on the recyclability of plastics and polluting California's communities. This is definitely a space that we'll continue to watch in terms of holding companies accountable for this pollution. Another thing I wanted to touch on, mainly because this is one reason why using plastics and having plastics is so concerning, and it was interesting to hear some of the efforts that have been made in the medical community to get PVC out of certain tubing as well as other materials, because in terms of food packaging, a recent report had found that, there's 16,000 plus different toxic chemicals and additives that are added to plastics when they're produced, things to help with UV protection to ensure they don't degrade as quickly, pigments and dyes and colors and anti-stick, and the list goes on. And this is particularly concerning because these chemicals are ending up in our body through ingestion of the actual chemicals, through ingestion of microplastics or nanoplastics, or inhalation through dust. Dust is quite a large source of exposure to micro and nanoplastics around the home, as well as leaching of chemicals into your food. Now, I think we all are aware that we shouldn't microwave food in a plastic container. But similarly, like as foods, particularly foods that have a lot of fat in them, are stored in plastics, food items, there is always the potential for those particular chemicals, for any array or mixture of chemicals to be transferred and leach into our food. There have been a number of studies over the last year even that have continued to show how microplastics are showing up in our bodies and where they're showing up in our bodies, as well as, a recent Columbia study that looked at plastic water bottles, finding, tens of thousands of nanoplastics in one particular bottle of water, in a single bottle of water, which is all very concerning. And another concern about the toxic chemicals in plastics is obviously when we're recycling them, there is a view that at some point there are materials that need to be part of a circular economy, that recycling would need to bring products back into products again. And there is a space for that for sure. But the more that these plastics contain toxic chemicals, we are literally just, the chemicals don't go away. They're just being recreated and redistributed back into new products. So there is a reason that we need to start reducing and pulling out the toxics that are being used in plastics so that we can actually make more sustainable food grade packaging. And then the lastly is, just also these chemicals pose real risks to the people that are working in recycling facilities and manufacturing facilities that are using these materials and recycling them. So just a couple legislative responses. I think that's what you all wanted to hear about. How are we actually reducing, how are we going about trying to reduce plastics just across the board? One of the most effective waste reduction, but also plastic reduction legislative mechanisms are container deposit legislation or bottle bills. Not every state has one of these bills. New York, a lot of the Northeast states have them. I'm not sure. I know that there are several other states that do. And this is the idea where, it was popular. I don't know how many people actually redeem their bottles. If you live in one of those states, it was really popular many years ago. It was something that started in the 80s. And honestly, it is actually the most effective way because you're getting the material back into the system. There becomes less waste, less, and the material that comes into the system actually has the potential to be recycled. So container deposit laws are good ways in terms of ensuring materials are being recycled, specifically in plastic. And it really is a form of what now this kind of new wave of legislation we're seeing across many states in the US is something called extended producer responsibility. Bottle bills are effectively a very early version of extended producer responsibility in that it shifts the responsibility back on the producer of the bottle or the material to have some role in the end of its life cycle and financial role in managing the waste. So extended producer responsibility laws have been passed in quite a few states: California, Colorado, New York is working on one at the moment. There are several others. I'm just not being able to rattle them off the top of my head at the moment. And they all kind of have varying degrees of how much they are expected to push the reduction of plastics. I like to talk about New York's proposed model because it really is the most effective model across all of the states, in that it actually drives reduction of plastics and puts actual obligations on producers to produce less plastic. And I have a couple other slides later on that that get to that point, so I'll save it for there. The other thing which, you know, we spend a lot of time working on are just kind of bans, single-use bans. So just saying there are some unnecessary plastics that just really shouldn't exist. And we've seen bans across the United States and other states on plastic bags, polystyrene and packing peanuts, foam coolers. New York City recently passed something called Skip the Stuff, which means a restaurant can't distribute cutlery or utensils to you in a takeaway container unless you're asked. The default is we won't give you single-use plastic materials to take away. Beverage rings, dry cleaning bags, balloon releases, you name it. There are quite a lot of pieces of legislation out there that deal at cutting down the use of single-use plastics, addressing plastics that are found in the environment through, balloon releases end up being a very particular problematic way that plastic can enter the environment and our waterways. This is a little bit on just New York's particular law that I was mentioning before. And for me, this legislation, while it's proposed, it passed our Senate, New York Senate last session, and we're hoping that in the next legislative session, which starts in January, we'll be able to pass this bill in New York State. But it brings together a lot of the components I was speaking about today into one package. So it holds the producers financially responsible for the end of the life cycle of particular products of packaging. It also requires that producers of packaging and brands reduce the amount of plastic that they use in their packaging. So this works in two ways. It kind of imposes a fee. The more plastic packaging you use as a brand, the more you're going to pay at the end in terms of your financial responsibility for the waste. The less you use, if you actually produce a product that's in a refillable container, you wouldn't pay into the system. So there is like a financial incentive and built into this proposal that would force brands and producers of packaging to go in a more refillable, reusable, environmentally sustainable direction. But in addition to that, there actually are legislative targets for waste reduction. And so that's significant because some of these programs won't necessarily drive the reductions that are needed at the pace that are needed to make a real difference. So those strong mandates are really important. It takes investments that producers and brands pay into the system and reinvest them into municipal recycling programs, infrastructure, as well as refill infrastructure. And the other exciting thing about New York's proposal, which actually hasn't been replicated really anywhere, is it would ban the worst toxic chemicals in plastics. So things like PFAS, formaldehydes, different dyes, there's, I think, a list of 12 particularly heavy metals and that are addressed in this legislation to ban. There's not one space that all these toxic chemicals have been banned in one spot. So New York would be the first. It's really just a patchwork of this chemical's banned here, this chemical's banned here, this chemical's banned in this space. So it would be really exciting for New York or for a state to really show leadership on saying these particular chemicals are incredibly dangerous and do not belong in plastic to begin with. PVC is in there. And the last bit that this bill does in New York is also doesn't promote that false solution of chemical recycling, and actually says that that type of recycling isn't allowed to count as recycling as part of this program. So that's pretty much all I have. Happy to ask questions of, you know, how people might want to get more involved in type of legislative advocacy. And yeah, thank you.
Thank you so much, Kate. I'm going to turn it over now to Miriam.
Yes. I see some questions and Oriana answered some of them. Already, let me see.
Yeah, I wasn't sure if we would have time at the end, so I wanted to be sure to address. I'm happy to expand on any of them if people have further questions.
You did answer the question regarding the financial impact of the reduction in the medical waste. You said almost like $5 million you're predicting, is that right?
Yep, annual savings. And we think that's on the low end of estimation for reaching that 50% waste optimization goal across our hospitals only. So that's kind of the foundational number that we think we can achieve.
And also there's a question regarding collecting data regarding infection control with using reuse items versus disposables. And I see that there's answers, all right? You do work closely with the IP department.
Yeah, and this question is asked more broadly, but this is really a item by item question. And so the process that came out of our Joint Commission Sustainable Healthcare Certification is an IPES working group, so infection prevention, environmental stewardship. And we really are a supportive role in that. So we're providing as much evidence and information and data that we can to the infection prevention team, but they need to lead the work, right? Of choosing which products to implement for case studies and then expanding across hospitals. So we're really in a supportive role, but yes, in theory, as we go through that item by item, so reusable gowns, isolation gowns, as an example, we'll be able to track the before, during, and after for a case study, and then we'll be able to track that data system-wide as we progress and expand.
Okay, thank you. There's another question. How did you involve the nurses, physicians, and infection prevention professionals in this campaign? I see that you mentioned about something about the green team. You have it in Providence?
Yeah, I think this question was about our program as a whole, and so that's kind of how I answered it. But yes, engagement, we always say, is our special sauce at Providence, because we have a lot of people across the organization that really care about the environment and this work. And so as part of our engagement strategy, we have green teams at every ministry. And so anybody can join a green team, facility staff, EVS staff, clinicians, anybody. And this is really a way for a localized team to understand our program as a whole, the data that we have, how to look at the data, how to use the data, and communicate that more locally and choose projects that make sense for their hospital. Because a hospital in Texas isn't going to choose the same projects that a hospital in Oregon is. Every green team, every facility is at a different place along their journey. And so we want to make sure those green teams are really understanding what we're talking about and helping the system team and the data meet them where they are so they can progress and choose projects that make sense.
And are the tools you use to calculate carbon emission and reductions available for other hospital system to use? See some answers here.
Yeah, so that's a kind of a complicated question, because the WEAC scorecard, again, is an internal scorecard that we've been building for multiple years. We do hope to be able to offer this to other health systems. We're just not there yet, because we're still wrapping our arms around our own data. It's an incredible amount of data. It's complicated to collect. I mean, a lot of it, like I said, is from invoices, so you can only imagine what that looks like. We're getting more automated and we're refining our processes. We have a Providence Global Center in Hyderabad, India, luckily, with software engineers that help us automate the process more and more. So I think in the future, we will be able to offer this to other healthcare systems, and we would like to, but we're just not there yet because we're still figuring out how to be more efficient in our own collection and analytics process.
How do the infection prevention concerns impact the new Joint Commission climate change voluntary certification?
Yeah, so this is a great one because we were the first large health system to be able to achieve the Joint Commission Sustainable Healthcare Certification for all of our hospitals, which was a huge lift for our local regulatory teams, our infection prevention teams, environmental stewardship teams. But the positive of that was it really brought all of these different teams together for the first time in a really formal way, because the Joint Commission, of course, everyone sits a little straighter, right? And we're all in these meetings, and essentially getting to the sites were able to brag about the work that they've already been doing. And so out of that became a lot of passion from teams that we hadn't previously engaged with. And one of those things was our infection prevention working groups that we're now looking at some of these initiatives that we talked about today. So that's pretty exciting for me.
Did you use any, or do you have any template protocol to get this started?
Yeah, so I was curious, and I don't know, I wanted to clarify which element. So the frameworks, because of course we've built it from 10,000 foot view all the way down to specifics. Yes, we have templates, we have spreadsheets. You know, we did this in Excel before we did it in the scorecard, right? With as far as our data collections and our carbon emissions calculations. So feel free to reach out to me if you have more specific questions about that, because yes, we have a lot. I'm happy to share what I can, but we'll have to be more specific about that.
This question is for Kate. Do you think that there is room to add healthcare plastics to ongoing legislative and advocacy effort?
Yeah, and I was just trying to type in a response. Absolutely. I mean, I think one of the really important things is just the diverse voices in this fight. And that having this kind of healthcare or health nurse focus is, to me, actually, after hearing it today, this presentation today, from two reasons. One, you can speak to the health problems as to why these are so concerning, right? We all know there's all this mounting evidence about microplastics and the toxics in plastics and what it poses, the risks it poses to our health, but also hearing stories that the health sector can reduce plastics. I think that's an important part of the story too, because that, like I said, is one area where we often carve out anything that's for medical purposes, right, has kind of a carve out. So I think legislators hearing that it's possible to have certain sectors and that sectors are moving in that direction is really important.
Thank you so much to both of our speakers, and thank you to our co-chairs, Miriam and Elizabeth Joseph. We appreciate you all joining our call today. This will be posted on our learning site, so you can visit that website. We will also send out an email as well, so you'll have that information.
Thank you, everyone. Have a good afternoon.
Thank you.
Thanks for having me. Take care.
Great presentations. Thank you.